Good morning, everyone. My name is Rosalind Daniels. I'm president and founder of Black Health Matters, and I'm here live with you. Please hashtag Black Health Matters. We're making a statement today. We're showing the nation that Black Health Matters, it does matter, and that you're lifting your voices so that everyone in this country can see. And now I have the pleasure of introducing you to Dr. Edith Mitchell, who's going to talk to you about prescription for exercise. But before we start, I just want to share that we did an article on Black Health Matters where we talked about the benefits of exercise, especially for those who have breast cancer and other types of cancer. Exercise is a great way to help modify risk factors and to keep you healthier and promote better outcomes. And Dr. Mitchell is one of the architects of speaking to patient populations about why they need to stay moving. Let me tell you a little bit about Dr. Mitchell. She is a board certified internal medicine and medical oncologist and is a clinical professor of department at the Department of Medicine and Medical Oncology at Sidney Kimmel Medical College at Thomas Jefferson University. She is also the associate director for diversity programs and the director of the Center to Eliminate Cancer Disparities for the Sidney Kimmel Cancer Center at Thomas Jefferson University. Dr. Mitchell is also the past president of the National Medical Association, where she launched this initiative, Prescription for Exercise. And now I have the pleasure of introducing you to Dr. Edith Mitchell.
Thank you so much, Ms. Daniels. I am so pleased to be here on a Saturday morning, and I want you to know I've already done my exercise for today, but I'll do more later, and I will talk about how you don't have to do it all at one time, that persistence and consistency are the important things. So, prescription for exercise. Why did I set up that program? It worked very well with the National Medical Association when I was president. So we say, why exercise? Well, exercise strengthens your heart and it improves your exercise potential, but it also increases blood flow, and that blood flow to other parts of your body increases oxygen levels. And with increased oxygen levels, what do you have? Well, there is better weight control. It combats many health conditions. It strengthens your brain and gives more oxygen to your brain. And with that, there is a decrease in many health conditions. And those include stroke, metabolic syndrome, diabetes, and many hormone secretions. And with that, that decreases many kinds of cancer. So we will talk about today obesity and cancer, especially in African American and other minority populations. So there's a crisis in this country on obesity. About 70% of all people in the United States have obesity, and that's even higher in the African American community. African Americans are nearly 1.5 times as likely to be obese as in the comparison with white adults. Approximately 47.8% of African Americans are severely obese, with another 50% that are overweight. So we really need to address this. Now, in addressing the obesity problem, we have more individuals who are African American suffering from many conditions, and that I'll talk about in a moment. The percentage of adults who do not engage in any kind of organized physical activity is higher among African Americans, and that ends up being approximately 30%. And in Latinos, 34%, and that is higher than whites, who are at about 22%. And 60% of obese individuals who do not engage in any activity, this is really important because they don't do enough physical activity to really have health benefits. A study of more than 30,000 healthy adult US women found that middle-aged women need at least an hour of moderate exercise or moderate activity every day in order to maintain healthy weight without either dieting or restricting calories. So there's a combination of health benefits combined between exercise and caloric intake. So what do we say about cancer? Exercise actually prevents and can decrease the risk of certain cancers. And I'll talk about that because as an oncologist, that is so important that we not only talk about cancer treatment, but we talk about cancer prevention and maintaining a body weight that is normal, combined with good exercise, and that exercise can be daily. That prevents or helps prevent many cancers. And you say, well, exercise, how much? You don't have to do it all at one time. You can use 10-minute breaks to do exercise, and 10 minutes 3 or 4 times a day is good. Also, because with the pandemic, so many of us are seated at our computers every day, and long sitting also contributes to a lack of exercise. So about every hour or two, get up and spend a few minutes walking in place, or doing some kind of exercise. So exercise, very important. So how about African Americans and cancer? Why am I, as an oncologist, so interested in prevention of cancer rather than treatment of cancer? So yes, I treat patients with cancer every day, but I'd like to look at those factors that can help African Americans in the quest to decrease our mortality from cancer. First of all, according to the American Cancer Society, Black Americans collectively have the highest death rate and shortest survival of any racial or ethnic group in the United States for most cancers. Black men, for example, are 50% more likely to develop prostate cancer in their lifetimes, and 2 times more likely to die from prostate cancer when compared to the comparison group, which is white Americans. So more Black men more likely to die from prostate cancer. However, when you look at overall cancer, Black men have the highest death rates of any racial or ethnic group in the United States. Let's go on to breast cancer. While the incidence of breast cancer is slightly higher in white women, Black women have a much lower 5-year survival rate. And that rate is 90% compared to 75% in white women. So a higher chance of dying of breast cancer. Moreover, because African American women develop obesity in early age, many Black teenagers are already overweight. African American develop breast cancer at a lower age than white women. And in fact, many Black women develop breast cancer younger than age 40. So they may not have even had the first mammogram by the time that they develop breast cancer. So obesity playing a bigger role in relationship to that. And we say not only is breast cancer more important and Black Americans develop breast cancer at a younger age, that is also true of uterine cancer. And that's really very important. And we say, why does obesity have something to do with it? Well, fat cells and fatty tissue maintain large levels and store hormones. And not only that, but fat tissue secretes estrogen and other hormones, which are known to lead to higher levels of cancer, especially in breast and uterine tissue. There's also the fact that there are some fat cells called adipocytes, and these adipocytes in the fatty tissue control growth of tumors, so that these adipocytes then can stimulate growth of breast tissue because of their control of breast tissue cells. The same thing is true of uterine cancer. So the important thing is that if there is fatty tissue, this fatty tissue not only stores estrogen and other hormones that lead to cancer, but the fatty tissue also secretes more. So when you look at individuals who are normal weight and have normal amounts of fat, the hormone levels of estrogen and exogenous estrogens are known to contribute to fatty tissues and also to cancer. There are other risk factors that are related to cancer growth and a disproportionate rate in which African Americans are affected by cancer. And they are the social determinants of health and socioeconomic disparities, such as redlining, where Black people were not allowed to buy houses in other sections of cities. And as a result of that, there are fewer supermarkets where you can get fresh foods, fresh fruit and vegetables. There are also a shortage of drugstores and a shortage of all of the contributors to our health, shortage of healthcare centers, shortage of good hospitals nearby. So all of those things can contribute. And therefore, with a shortage of health centers, a shortage of supermarkets, a shortage of drugstores, that leads to the quality and the amount of healthcare that is accessible by African Americans. The ACA, the Affordable Care Act, has actually contributed to an improvement in healthcare access and cancer care access for African Americans. There may be some genetics and biological differences with, for example, triple negative breast cancer being twice as prevalent in African Americans as in our white counterparts. So that's really important. There may be some biological differences, and therefore very important to know your family history. In many situations, African Americans don't talk about cancer. They call it the C word, and they don't talk about it. So it's very important for us to begin talking about cancer, talking with our mothers and grandmothers and other relatives about who in the family has had breast cancer or any cancer, because some other cancers can contribute to the family history and therefore the risk of breast and uterine cancers. There are environmental factors. More African Americans live in communities where there are factories and other environmental contaminants that can contribute to cancer diagnosis, and especially breast cancer. And then the least, diet and exercise. And we've got to start moving. We need to sit less. We need at least 150 minutes per week of exercise. And we may split it and do 10 minutes here, 10 minutes there. And also, we can do things in our houses, because the exercise of vacuum cleaning or sweeping or other work in the house, that counts as a part of that 150 minutes per week. So we need to exercise, but also doing the housework and keeping the house clean can add to the exercise that we need each week. And we also say, well, what does exercise contribute? Well, we want to decrease, one, the hormones that are secreted in fatty tissue, the hormones that are stored in tissue, and also obesity carries low levels of inflammation. And inflammation contributes to a number of factors. It increases insulin levels, and insulin stored in fatty tissue can cause growth of cells, and that growth of cells then leads to a number of cancers. So that increases inflammation, it increases insulin levels. Obese patients have higher levels of insulin, and that insulin connects to what is called an insulin growth factor, or IGF, that is also in fatty tissue. And IGF is another factor that controls growth of cells, and these cells can then develop into cancer. So very important. So what are we talking about in terms of cancers? I've mentioned breast cancer. I've mentioned prostate cancer in men, but also colorectal cancer. Colorectal cancer in the United States has a 20% higher incidence in African Americans. So African Americans have a 20% higher chance of developing colorectal cancer. And overall, African Americans have, if they get colorectal cancer, have a 40% higher mortality rate or higher chance of dying than whites. In fact, African American men are even higher in terms of the death rate. African American men have a 47% chance of dying of colorectal cancer. And again, if men are obese, they have a higher chance of having higher estrogen levels. And African American men, therefore, develop more tissue across the chest or in their breasts. And African American men have a higher chance of getting breast cancer. Yes, men do get breast cancer, and African American men, especially if they're obese, have a much higher chance of developing breast cancer. So, what does exercise do? Well, exercise decreases the estrogen levels that is stored in fat, and it therefore decreases the metabolism of these other hormones, such as produced by the adipocytes that cause cancers. So therefore, exercise decreases insulin levels, decreases insulin growth factor, and therefore can greatly contribute to the decrease in development of cancers. In fact, for breast cancer, there have been comparisons and studies done to show that women who actually complete 150 minutes per week of exercise decrease their chances of getting breast cancer by 40 to 50%. So the data shows that exercise does prevent cancers and does prevent, therefore, death from cancers. So again, exercise can reduce the chances of getting cancer by 40 to 50% in some cancers. And this has been especially measured in women having breast cancer. There are other cancers also that are caused by obesity. I've mentioned breast cancer in women, prostate cancer in men, colorectal cancer in both men and women, and I've mentioned uterine cancers. But there are other cancers caused by and associated with obesity in this country. And that is because the hormones that are stored in fat, as well as those that are produced by fatty tissue. And these include, in addition to breast, colorectal, prostate, and uterine cancer, kidney cancer. Yes, African Americans do get kidney cancers, and they are more prevalent in obese women. Cancers of the head and neck region, again, usually thought of being associated with cigarette smoking. And yes, cigarette smoking does contribute, but also these cancers are more prevalent in obesity. We don't know if the obesity is an actual contributing factor or whether obesity associated with cigarette smoking may add. Pancreatic cancer, another. Stomach cancer, another. Gallbladder cancer, another. And cholangiocarcinomas, which is a specific cancer of the bile ducts in the liver. So all of these can be contributed by obesity, the incidence rates as well as the mortality rates. So everybody, we need to get up and move. Get up and move because it gives oxygen to our tissues and therefore less obesity and the consequence is a less incident of cancers. So what is the role? And why did I say doctors need to do the prescription for exercise? But actually the prescription of exercise, I initially started to focus on physicians helping prevent cancer. But now I'm saying that individuals can write their own prescription. So this is a time where the doctors and healthcare workers can contribute, but also each individual write your own exercise prescription. And therefore, you can write for, is it walking? Is it pushing the vacuum cleaner? And yes, I vacuum my house. And when I do, I'm thinking about the exercise that I'm doing. So I've been up this morning. My exercise was complete. I got my 30 minutes in on the treadmill. It's raining where I am now. So I've spent 30 minutes on the treadmill and cleaned my house. So we can all write our own prescription for exercise. And that prescription allows us to do what? Schedule the exercise time into our daily events so that you can write it for 4 times a day, 1 time a day, whatever you need, so you can have the 30 minutes per day as 1 time prescription, or if you would rather have it broken into time areas where you write your prescription for 10 minutes of exercise 4 times a day, or whatever your needs are. Now, if you have not had regular exercise in your daily plan, I will say, talk with your doctor or healthcare professionals before you begin an extreme plan or prescription for exercise. But yes, this is one time where patients can write their own prescriptions. So the prescription for exercise, we know, and I've discussed, that there is strong evidence that higher levels of physical activity are linked to a lower risk of several types of cancers. And I've given you those types. But in summary, I will say again, bladder cancer, breast cancer, colon cancer, endometrial cancer, prostate cancer, colon cancer, and others can be, our chance of getting those cancers are decreased by exercise and a decrease in obesity. The decrease in obesity, very important. So if you need to add a diet or reduction in calories to actually lose weight, that's important because it's all part of a 360 of health and a 360 of helping to prevent cancer. So diet, making sure that we have the appropriate food. But if you want to lose weight, you've got to increase that exercise to about 100 minutes for most people daily. I've also mentioned that the link between physical activity and reduced cancer risk is very important. And an increase in physical activity may reduce an individual's cancer risk. One, by lowering the sex hormones, such as estrogen and the metabolites of estrogen, preventing high levels of insulin. Yes, and it decreases the levels of insulin in the body. And yes, insulin is stored in fatty tissue as well. And high levels of insulin actually stimulate insulin growth factor and therefore insulin growth factor controls the growth of tumor cells and can stimulate and increase the growth of cells, and thereby that leads to cancers.
Dr. Mitchell?
I've mentioned low-level inflammation, decreases inflammation. It improves the overall immune system and decreases inflammation, and it helps prevent obesity. So for everyone, write your own prescription, and your prescription can help increase the time that you live and the risk of dying of cancer. I thank you so much for listening to me, and let's everybody write your prescription and get up and move. Thank you.
Yay! Thank you, Dr. Mitchell. You've got the country moving.
Let's move.
All right. Thank you, everyone. And we thank you, Dr. Mitchell. And now on to our next session. Thanks.